Welcome everybody and hello. Thanks for joining us tonight. My name is Stacy Dem and I'm the Executive Director of the ARC of Washington State. Before we get too much further, I want to make sure anybody listening is on Zoom. Go down to the bottom of your globe and make sure you select the language that you'll be listening in tonight. If you're listening in English, select English. And if you'd like to hear our presentation tonight in Spanish, you can click Spanish. We were just trying to work out the Vietnamese interpretation and our Vietnamese channel is not working this evening. We can't seem to troubleshoot it. So I apologize about that. We'll make sure and get materials in Vietnamese that will be on our website. But for tonight, we'll just proceed in Spanish.
Bienvenidos a todos, muchas gracias. Queremos decirles que vamos a ofrecer interpretación en español, entonces queremos que ustedes miren el icono que está en la pantalla abajo para seleccionar el canal en español si quisieran escuchar en español o seleccione inglés si quisiera escuchar en inglés. Desafortunadamente el canal vía vietnamita no está funcionando hoy, así que no vamos a poder ofrecer servicios de interpretación al vietnamita hoy. Muchas gracias.
Thank you, Linda. And does that make it so that everybody understands which channel? Did you just interpret what I said?
Yes, I did.
Great, thank you so much. Okay, so again, I'm Stacy Dem, the Executive Director of the ARC of Washington State. We advocate for people with intellectual and developmental disabilities, ensuring their full participation in all aspects of society. I'm also a family member. I have a sister with a developmental disability. The first thing, I want to make sure that you also know that Diana Stadden is here tonight manning the technology and helping us with the webinar format. She may pop in and out, either to remind all of us to slow down when we're speaking, since we do have interpreters, or to let us know if we have another technical issue. So thank you, Diane, for being here. Tonight, we're going to listen to a question and answer forum on COVID-19 and vaccination as it relates to the developmental disabilities community. It'll be everything you need to know, knowing that we have new information every week just about at this stage. We've had another one of these, and even since that time, everything has changed. So we're excited to bring you new information. I'm thrilled tonight that we have three extremely specialized, skilled, and trusted respected professionals in our world of developmental disabilities to give us some perspective and information. I'm so grateful for their time and expertise. Just so everybody knows, we'll be recording this event and we'll have it available for viewing on the ARC of Washington State's website in just a few days. We'll also send some follow-up links and information to people that have registered for this event. So if you have to leave early because of your caregiving needs or you want to pass this around to friends, please feel free to do that. You can find the link at the arcwa.org, arcwa.org. So this is in a webinar format, just to control some of the hubbub that can happen when we have an open Zoom, but we intend for this to be interactive. So if you'd like to say hello in the chat or put questions in the Q&A section, feel free to do that. We'll be having our guests answer some basic questions and then answer any additional questions that people have before we leave. So here we go. These are our panelists. I'd like to introduce you to Dr. Suman Pandey, Dr. Peter Asante, and Dr. Tom Kirkpatrick. Dr. Kirkpatrick, why don't you kick us off and tell us a little bit about yourself?
Yes, hi everyone. Thank you, Stacy, for this invitation. And I just wanted to say I'm thrilled to be a part of the panel with Dr. Asante and Dr. Panley. I'm a pediatrician at Hope Central Pediatrics and Behavioral Health, also the director of VFAB, Vietnamese Family Advisory Autism Board, and I am a mother of 3. I serve on the Washington State Developmental Disabilities Council. I have a nephew who has autism, and I am glad to be a part of this webinar tonight.
Well, thank you so much. You are busy. That's a lot. Thank you. And next, Dr. Pandey, would you talk a little bit about yourself and let us get to know you?
Thank you, Stacy. I'm Suman Pandey. I'm with the Yakima Valley Farm Workers Clinic at Yakima. I'm working in the community health center, and I see a lot of developmental disability patients. And I've been here for about 10 years now.
Thank you. The magic of Zoom. We can have you here with us. I appreciate it. And last but not least, Dr. Asante, tell us a little bit about you.
Oh, no, very least. Hi, everybody. Good evening. I'm Dr. Peter Asante. I am also actually living in Yakima. I am a general pediatrician and also see adolescents here at another community health center called Yakima Pediatrics. I'm also the medical director of our adolescent clinic that is out here, as well as chief of pediatrics at Yakima Valley Memorial Hospital. In terms of some of the work that I do, I am a board trustee at the Washington chapter of the American Academy of Pediatrics, as well as vice president of the Washington School-Based Health Alliance. And so a lot of the work that I do intersects with a lot of the families and young people that are here tonight. So thank you for having me.
Well, thank you so much. You are all such busy experts and caring physicians. Thank you for spending your evening with us. So as most of you know, COVID-19 has had just a devastating effect on our world population. And Washington was the first state to identify someone with COVID-19 in the United States. As most people know, it's had a particularly devastating effect on older people, but also people with developmental disabilities, especially people with developmental disabilities living in congregate care settings or who receive care from shift staff who may work more than one job or in a variety of settings. In addition, many people with developmental disabilities have underlying conditions that may make them more vulnerable to COVID-19 effects. Recent data shows that for people with Down syndrome, for example, may have up to 10 times the likelihood of severe infection or death when they do get COVID. So thankfully, we have vaccinations becoming more and more available to help prevent and protect the spread of COVID. And in fact, starting on April 15th, everyone in the state of Washington is eligible for a vaccine. We can't be more thrilled about that. But some of the information about vaccines and their risks and benefits have been confusing for people. And there's a lot of vaccine hesitancy, particularly in communities of color. And for people with developmental disabilities, our workforce is largely made up of individuals from BIPOC communities. In addition, people with disabilities themselves are a little hesitant because they're worried about their medical conditions or other medications they may take. So tonight is a space for us to welcome all questions and to learn a lot of important information. So I think, Dr. Tom, let's get started with you. Let's see if you can give us some basic general history and background on COVID-19. Just frame this unique virus for us, and then we'll get a little more reminder of why we're talking about this. And I'm not sure, Diana, do you have the presentation queued up? Can you add in Dr. Tom's first slide?
Just a minute.
I can just talk while you're getting
That
the
would
slide.
be good, yes.
Yeah, so yeah, thank you, Stacey. As you know, we've all been living in this global pandemic for over a year now. We know the culprit behind this is the coronavirus disease 2019, COVID-19. We know that it's caused by the SARS-CoV-2, which is part of a large family of viruses, the coronavirus. And I think of corona like kind of like crown. When you look at the picture, you've seen the virus, you see those little red dots. I think of them as like gumdrops that are all around that coronavirus. And these viruses, this one in particular, they call it the novel coronavirus, causes respiratory illnesses, like common ones, just like having a common cold, to more like severe illnesses. And we've seen that and heard about those severe illnesses throughout this global pandemic. And what has been devastating is that it spreads. It's a community-wide spread. And so how, it's spreading through the droplets as we're talking, singing, and sneezes. And so it's really important to think about the social distancing, we've talked about prevention, and so I know we've been engaged in that for over a year now. You know, we're washing our hands frequently, some of us to the tune of happy birthday. You know, we are putting that social distancing space. We're trying to be careful, that 6 feet apart, wearing our mask. And just the reason for this webinar tonight is getting vaccinated. And so the vaccine in the state, or in the US, we now have 3 vaccines that are authorized for emergency use. And I just wanted to highlight them as I think about the 3 vaccines. First off, I would group like the Pfizer and the Moderna vaccine. They are both mRNA vaccines. And then the Johnson & Johnson J&J one is more of, it's from an adenovirus vector vaccine. I think about Pfizer and Moderna both require 2 vaccines. The J&J one is just a single vaccine. The way they're stored, I think you just can put the J&J in the refrigerator. The one for the Moderna is a little bit, you know, it requires a freezer, kind of more at 36 degrees Fahrenheit. The Pfizer one is even more robust, like ultra cold at like 94 degrees Fahrenheit. And then the age requirement. If you are 16, you would want to go with the Pfizer one, because that's for 16 and older. The other 2, you can be 18 and older. And the efficacy rates are great. For Pfizer and for Moderna, it's about 95 and 94% respectively. The J&J one is around 85% for severe disease, 100% for hospitalization. And I wanted to point out that these vaccines do not contain the virus, so you will not get COVID-19 disease. And so that's really important to know. And another question that kind of comes up a lot is, will the mRNA interact with our DNA? And it doesn't. It really doesn't. And one of the things is if I have the slides, it helps to see some of the pictures, but I'll just keep, talking just about the vaccines in general, how they work. You have the mRNA vaccines. The way those work is, when you look at the picture of if you can, yeah, oh, there it is. So if we advance, keep going, more. Okay, one more. Okay, there it is. Oh, back one. And Diane, if you can go back one more. Okay, there you go. So both the Pfizer and the Moderna vaccines are mRNA vaccines. And so how they work is that the little red kind of gumdrops I think of on the outside of the virus, those are spike proteins. So what has been done is the spike protein DNA has been sequenced and copied. And then that DNA is copied into an mRNA form. And that you can see that those little squiggly green things that are in that light blue bubble. And then you take that mRNA and then you put it inside a capsule. So you're encapsulating in this liquid nanoparticle. And that liquid nanoparticle is what is in the vaccine. And it's really fragile, it'll break apart. So hence the very high temperatures or cold temperatures for storing them. And so once it gets into your body, in your cells, that mRNA is released from the lipid and it enters your cells. And that mRNA has instructions, and it to help your body it goes through this process translation, and you make this antigen, which gets presented on the outside of your cells. And that has like the spike protein information in it. So your immune system gets activated, and you have T cells and antibodies that are ready to go and prime. So if you are exposed to someone with a virus, then your immune system is able to recognize it quickly and begin to start destroying the virus. Next slide. And so the next slide is, this is the J&J one where it's a viral vector vaccine. And so it takes a harmless virus, the adenovirus, and so that's the mechanism, it's the vehicle that it delivers the mRNA. And it goes through that same process that I talked about, where it gets into the body, and you make that antigen and you present that outside, and so if you're exposed to the virus, then you're able to, the body's able to recognize it and start attacking it. Next slide. I like this illustration because a lot of people are asking, well, what about, they're afraid about vaccine reactions, and so to the left, we know a lot about about the COVID-19 symptoms. Maybe you've experienced some of them already. And then in the middle is more of an overlap between the vaccine reactions that are similar to COVID-19 symptoms. And I have to say, I know we've gotten our vaccines as pediatricians, and I've had experienced some fever, fatigue, headache. And it was just for 1 or 2 days. I just kept taking Tylenol around the clock for those 2 days, and I was fine. But now I've had both vaccines, and I am set, because if you are vaccinated, then there's just more engagement that you can have socially with people, and so that is a plus. And interestingly, in the state of Washington, we have, as of yesterday, have vaccinated, or actually number of vaccine doses given, 3,722,703. So woohoo, go Washington State.
That's great. That's some very thorough information, Dr. Kirkpatrick. Thank you so much. I thought I might circle back maybe with Dr. Pandy and Dr. Asante. Dr. Pandy, how is this vaccine different from the vaccines we get as children, like for chickenpox now, measles, rubella? Are there similarities or differences from this vaccine?
You mean compared to the COVID vaccine?
Yeah.
Well, this is basically like a new recent vaccine, and it's only been for a year, so we're still learning as we are giving. And the other vaccine, we pretty much know a lot about it. But usually all vaccines work the same way. They help your body to produce antibody to fight against if there's a real infection. So basic mechanism is the same, just the duration. This is like a new one, and then we'll have to see.
And I heard Dr. Kirkpatrick say that the live virus is not in the COVID-19 vaccine, and that's an important thing to understand. Can you talk about that a little more?
There is no live vaccine, so there is no way you're gonna get COVID infection with the vaccine that have to infest. Like a lot of parents, they're always like wondering if they can get a real infection with the vaccine. So you should not get any infection with the vaccine. There is no live vaccine, like virus, so there should be no infection. You'll have side effect. That's very common, especially after the second dose, that we have seen all those side effects that Dr. Kirkpatrick talk about, like fever, feeling tired, like sore arm. It happened to me too, like, but usually it lasts for a day and then it should be fine with the Tylenol.
Thank you. And Dr. Asante? How come people get symptoms from the vaccine, and how come some people react way more than others?
Yeah, that's a really great question. And everybody's body is a little bit different, right? And so one thing that we always talk about, and we have this conversation every time we give vaccines, even to children, and every year with the flu vaccine, is that, what we do know is that you will not die from any side effect of the vaccine. And I think that that's super important for us to talk about. What you will, whatever side effects you do experience, really is related to your body's immune response to make sure that if you ever are exposed to somebody that has coronavirus, that your body will be able to recognize it quickly and then beat it, such that you don't get sick or hospitalized or die. And so, in fact, what I have always told people is every year when I get the flu shot, I don't get any, side effects. But if somebody gets a flu shot and they get, that sort of cold symptom, sort of like the fever and fatigue that sometimes you can get for a couple of days, it probably means that their immune response is better than mine, honestly. And I think it's really great that it triggers your body to sort of build this response so that when you really do experience the real thing, God forbid that happens, you can keep yourself and your family safe. And that's at least me as a child health advocate, what I care most about.
Do you think so? Should people worry about getting symptoms, and what can they do about them?
Yeah, when I think we can all speak about our vaccine experiences, and one vaccine experience is just one vaccine experience. But, the first time that I got my coronavirus vaccine, similar to Dr. Kirkpatrick, I had like arm pain for 3 days. I woke up in the middle of the night and I felt really terrible, and like had some chills. And then by the next day, I was all better. And then the second time I got the vaccine, I was actually quite ready to have an even bigger response, and then I had nothing, And so I think that that's why we don't worry as much about the side effects, because we do know that every vaccine does have side effects, but part of the side effects are actually related to your own body's immune response. And it doesn't, one of the things that we talk about when it comes to coronavirus is that the scarier thing is getting coronavirus. As we know, there are lots more variants that are out there now, ones that are much more infectious, ones that are much more likely to land you in the hospital. And, when you compare all of the people that have gotten sick and or hospitalized or died, and you compare that with the people who got the vaccine, there are 0 people that ended up dying because of the vaccine. And I think that that is an important thing for us to talk about, because I think we all get very worried about what side effects we personally are going to experience. But at the end of the day, we do know that people that are vaccinated now, that their risk of getting sick is lower, but their risk of transmitting the virus to other people is lower. And as you said, Stacy, the data is constantly changing and evolving because we're living in a very unique time. But that information about the lower risk of being able to give coronavirus to other people, even if you are vaccinated, is very new. And as a result, it means that the benefit of vaccination is that you will not be a silent, asymptomatic spreader. Which is the other part that we don't talk about, because we do know that 40% of people that get coronavirus get no symptoms. And so if you're lucky enough to not have any symptoms, but you go to visit grandma, then grandma could have symptoms and could unfortunately die. And so I think that the scary part for me is everybody's body is different in terms of how they handle coronavirus, the actual disease. But the thing that is reassuring for me is that the side effects related to the vaccine are predictable. And I would much rather sort of take that at this point, because we can manage those side effects really easily, and we know that those side effects are not going to kill us.
Thank you. That's a really important point. I've heard some physicians say, I've lost many patients who die from COVID-19, but nobody from getting the vaccine. So thanks for raising that. Dr. Kirkpatrick, I'm wondering, so two of the vaccinations, you get 2 shots, and one of them, Johnson & Johnson, you get 1 shot. Is one more effective than the other? And there are a lot of questions about if I get the 2-shot vaccination and I get the first dose, but I have a hard time getting the second dose. What should I do about that, and how long can I wait?
Yeah, so those are great questions, Stacy. What I kind of advise is that get one of them, the one that you can get. So if it's J&J that's available, get it. If it's the Pfizer, get that one. If it's the Moderna one, get that one. The 2 shots, for the Pfizer and the Moderna one is it's based on kind of the efficacy. But when they were doing the kind of the preclinical trials, they had the phase 1, phase 2, phase 3. And this is something I also wanted to add, because, it wasn't just like, okay, here's emergency use, we're just going to start, vaccinating people. But actually they actually had enrolled about like 30,000, I think in one, 40,000 in the other. They kind of went through each of, phase 1, phase 2, phase 3, and kind of learned about upper limits, lower limits, side effects, and all of that. And so out of all that, I would say it's, if you can only, it's safer that, for you to get the vaccine unless you have some of those contraindications. And if you can only get one, because let's say it's really hard for you to get out, and it's just logistically, then get the J&J one, because that's one. But they're very, they're getting very savvy out there. You don't even have to, there are places you just, these lots where you just stay in your car, and, they kind of give you these little plaques, and then, they'll come by and they'll tell you, move here, and you don't even have to get out of your car, and they'll come and give you the vaccine. So, there's a lot of, there's a lot of kind of thought into how they can make it more available, even like mobile vans and things like that. And I think a lot of people have chipped in to help fire departments. It is amazing just how people have mobilized to get us vaccinated.
Yeah, thank you so much. That's great information. Dr. Pandy, if I've had COVID-19, should I still be vaccinated?
Yes, absolutely. You should. The reason is once you have COVID, there's some antibody, but we don't know how it's going to, how long it's going to last. But with the vaccine, with the full doses of vaccine, it kind of ensures you that you have antibody. And then usually also with the natural disease with the virus, we just don't know, is it going to protect you? Also, like that's one thing. And with the vaccine, that kind of ensures you that you have antibody. And then so far, on the trial, whoever got the vaccine, there has been no death because of the COVID vaccine, and there has been like no serious infection. So they haven't been hospitalized. No one have ever been hospitalized because of severe infection. So at least kind of ensures you that you will be protected. So absolutely, you should get the COVID vaccine, even if you got the COVID, even if you got the COVID infection.
Okay, that's great.
Stacey,
Yeah.
Stacey, I'll add to that just because we do know, sorry, that was my phone that just went off. I will add to that because we have so many variants now. Just because you got one type of coronavirus does not mean that you're protected against all types of coronavirus. And in fact, what we know with respect to the vaccine is that if you are vaccinated, your risk of getting sick from the variants is actually quite low. And so we are still currently working on collecting that data day to day. But just because you got the virus 6 months ago, Dr. Pandy's right, your immunity might not last as long as you want it to. And it does not protect you from some of the other variants that are circulating in the US from different countries, but also most recently from Florida. So it is super important because with these different variants, them being more deadly and more transmissible, meaning you can spread it much faster, just because you got one type doesn't really mean anything at this point. And that's the benefit of getting a vaccine that has such significant coverage against all the different types of COVID-19s that are now out there in the world.
Great. Well, and now I want to dive in a little bit more about issues specific to people with developmental disabilities. So that's people with autism or cerebral palsy or Down syndrome or epilepsy or any number of other congenital issues. What are the issues that people with developmental disabilities really need to consider around the vaccine? For example, is there any reason not to get the vaccine if I have a developmental disability? Or is it more dangerous for me to get a vaccine if I have a developmental disability? Dr. Asante, you want to get us started off on that?
Yeah, I mean, so, in terms of contraindications, meaning reasons to not get the vaccine, it is like this small. It is a very, very small number. And part of that is even if you've had a severe, and I mean severe, like needing an EpiPen type of severe allergic reaction to prior vaccines, even the number of people that have had severe allergic reactions to the COVID-19 vaccine is also extremely low. Like compared to the tens of millions of people that we have vaccinated, it is probably a couple handfuls that has happened to. And in those cases, that is actually one of the reasons why we will have you wait for 15 to 30 minutes after the vaccine just to make sure that everything is okay. But again, even initially when we first heard about this, everybody was really worried that this was going to become a big phenomenon. And that really is not true. That actually has not happened yet. And since we've actually vaccinated more people in mass, the comparison is quite low. The other thing I also tell families is I'm like, at the end of the day, I think everybody should get the coronavirus vaccine. And I think about this the same way that I think about the flu, particularly with my patients with developmental intellectual disabilities, but also our medically complex patients, ones that might have a tracheostomy or they need a ventilator to breathe. Patients and young people and families who have children in these higher risk categories, it is possible that in these settings, coronavirus might actually be more deadly because in terms of the defenses that, especially if you need a ventilator to breathe that you might have to fight coronavirus, your body might have to work harder in the same way that like if you got a really nasty flu, your body would have to work harder. So the idea that that there would be a certain group of people that it is not safe for the vaccine, for them to get the vaccine, that is actually why we're studying it in children now. Because if we had noticed that in any of these trials, in any of these groups, that it was unsafe, and especially with our massive vaccine campaigns that we have had to date, that Dr. Kirkpatrick sort of highlighted, we would have stopped this process by now. The last part that I'll say to that is that when we do vaccinate people, and this is actually also true for children's vaccines, we actually continue to follow the information. It's called phase 4 trials of monitoring if there's any severe adverse reactions. So all of the people that have been vaccinated up until this point, any potential reaction that might happen as a result of the vaccine gets documented and then submitted back to the drug companies that are making the vaccine, as well as the Center for Disease Control. And because of that, we feel confident enough that the reactions that people might get are so low and not as scary that we are like, yes, let's study children, right? That's why we studied adults first. And so I would say that just because you are in a special population, I would not think that you are not entitled to live in a world where you don't have to deal with coronavirus. And therefore, we know that it is safe for you to get it at this time.
Thank you. Yeah, that's really important information. It sounds like you're saying people with developmental disabilities really should go ahead and get the vaccine. Dr. Kirkpatrick, I was going to ask, there are a lot of people with developmental disabilities who take some medications. And I'm wondering if there are medications that might make someone either more at risk of side effects or reactions from the vaccine, or if a certain medication would make you, think twice about the vaccine.
Yeah, and I think that's another great question. I just wanted to say, yes, what Dr. Asante had just given you advice about, it definitely is recommended for everyone, and we do recommend that unless you do have like an anaphylactic reaction to a component in the vaccine, or the medications. There is, like, if you were you have an illness that you require monoclonal antibodies, or just convalescent plasma, then yes, you can't get the vaccine right away. You will have to wait about 90 days. But so there are certain situations that certain medications, and what I advise is to speak to your doctor, and that would be the safest thing. But it is one of those things, you would be like, why shouldn't I get it?
That's great. And then just to kind of drive this point home, Dr. Pandy, I'm just curious, I want to hear one more time, is there anyone who should not get the vaccine? Because for a while we were hearing maybe people who are pregnant shouldn't get the vaccine, or people with HIV/AIDS maybe should think about that. Do you think there's anybody who should really not get it?
No, everyone should get the vaccine. The only contraindication, I think we already talked about that, is like if you have severe allergic reaction to the vaccine component. That's the only reason. And a lot of parents, they also have like question regarding what if you have like an egg allergy or latex, and then there is no like egg or latex or preservative on those vaccines. So even if you have any other serious allergies, you can still get those vaccines. And the component of the vaccine, I was doing some research, and most of like the important component on the mRNA was polyethylene glycol. But there are others, but that's nothing that stands. Those are not usually commonly used stuff there. So usually egg allergies, other allergies, they can always get those vaccine. So
that's great. And if somebody just still isn't sure, who should they talk to get more information?
They can go through the website, government website like cdc.gov. They can start from home, and also they can always talk to their go to their PCP doctor and then get the more information.
There we go.
Well, usually I'll recommend like starting looking at the authentic, like the websites, like a government's website like cdc.gov, rather than like going through all those internet blogs and other like other those information. Go to the authentic website, look there, do your research, and if you're not still satisfied, then go to your doctor and talk about it.
Dr. Asante, you sounded like you looked for a minute like you had a good answer to that one.
I was just like, call your medical provider. Like, I can't stress this enough. Like, we are all steeped, like buried in this information, and are constantly getting updates and constantly doing reading and listening so that we can provide you and your family with the best information possible. And I tell families, the reason why I got the coronavirus vaccine was to prove to the families that I serve that if I'm willing to do this so that I can continue to be the best medical provider that I can be, then I'm doing this not just for science, but also so I can be here long enough to take care of your child. And so at the end of the day, I want to have this conversation with my families, and I want to make sure that we are providing evidence-based information. And Dr. Pandy's right, there are these, the CDC website is amazing, but if you feel overwhelmed by that information, that's why we're here. And we're more than happy to have this conversation and many other conversations with you. In fact, I have several of them every single week, and I have several of them scheduled for next week with my patients. So please do not be afraid to reach out to us. That's why we're here, to support you.
That's great. We've had a lot of conversations about vaccine equity at the Department of Health here in Washington State, and local hospitals like UW and others. They talk about the unique barriers that people with disabilities may face in getting access to an appointment. That might include, standing and waiting out in the cold in a long line. For people with autism, that's really hard. How do we help the state and clinics to really understand how to make the vaccine most accessible to people with developmental disabilities? Do you have any ideas about that? Dr. Kirkpatrick, you want to chime in there?
Yes. So, when the vaccines was first open, we understood it to be for the first responders, some medical providers and such. And but the DD community was not included in that. And there was a lot of lobbying done. And so, it was an eye opener for all of us. And so I think a lot of this is conversation. Kind of asking people what are their barriers, and then making those known, and then and being resourceful in terms of being creative, in terms of how do we help people with these barriers. Do we need to come to their homes? Do we need to be a little bit more gentle when we're giving the vaccine? If the patient is not able to wear a mask, how do we address all of these barriers? And I think it is important to have an open and honest discussion, and to put it in the forefront. And so it's really important to address that. So it's a very important question.
Great. And Dr. Pandy, for people with developmental disabilities, being socially isolated has been really hard, and wearing masks for some people with developmental disabilities is really hard. And people are feeling really isolated. I think what's on a lot of minds of people with developmental disabilities, if all of my friends have been vaccinated, can I hang out with them safely again? And can I stop wearing a mask?
Well, after the vaccine,
yes.
Well, once you have the vaccine, and as per new CDC guideline, then then you don't have to put a mask, and you don't have to maintain social distance if both people are vaccinated. But if not, then you still have to do the same thing. You still have, if you are in the room and there are people who hasn't been vaccinated, then you still have to put on the mask and maintain the distance. But if both parties have been vaccinated, then you don't have to now as per new CDC guideline.
Thank you. That's a great piece of information. We should still keep wearing masks, it sounds like, because we don't know who hasn't been vaccinated. But if you're sure that everybody in the room has been vaccinated, it might be okay to take it off. Okay. And then Dr. Asante, let's talk about kids for a minute. We are hearing that there's a trial for younger kids under 16, and that might be coming about. We know that school reopening is, happening, and for students with disabilities, they've really suffered from not being able to go to school and get their therapies and specially designed instruction. Remote learning really hasn't worked well for a lot of children with disabilities. What are your thoughts about the risks of children with disabilities going back to school? How long do you think it'll be till we know that younger children can be vaccinated? And what do you think about the long-term effects of kids with disabilities not being able to be back in school and with other children?
Stacey, I'm really glad I got this question because this is a particular passion of mine, which is that kids need to get back to school. And in the context of this pandemic, we have focused a little bit too much on certain types of businesses getting to be open and certain recreational activities getting to take place, but we have locked kids in their homes for the last year. And particularly, young children or families with children with an intellectual developmental disability who need services at school. It has been devastating to see the impact on our children. And it just sort of really saddens me because we see a lot of these children in clinic, and we know that a lot of the things that they're suffering from would be fixed by going back to school. So I think that the impact is going to be felt for an entire generation in terms of the way in which we thought about youth and school when we sort of locked our country down, and the sort of like delay in terms of being able to get kids back to school. When I think a little bit about sort of the vaccine efforts, especially with respect to teachers, I'm very excited about the fact that we will be able to get kids back to school, hopefully by fall, because, the great thing, especially with kids under age 9, we know that the risk of getting severe disease is actually quite low. And we also know that different from flu is that, when it comes to flu, children, we all take care of children. They're gross. And so as a result, they are usually the reason for the spreading of the flu. We call them super spreaders, by the way. And as a result, that's why we are so aggressive about vaccinating children. The great thing, in the context of coronavirus is that, while kids are not going to get super sick, at least kids under age 9, they still can be vectors of the virus, right? And so they could go to school, get it from somebody, and bring it home. But it really is adults that have been doing the heavy lifting in terms of spreading the disease up until this point. We take our cues from spaces like daycare centers, right, who have been open this entire pandemic, and we have not seen a lot of outbreaks. And that's really, really, really reassuring. And so because of that, I think it's really important for us to get our adults vaccinated, but naturally we need to get everybody vaccinated because as the virus continues to mutate, this information that I just told you might change. The other thing is that we are doing the studies right now on children, and one of the drug companies has got their age range all the way down to 6 months. And so those studies are happening right now from essentially 6 months all the way to the groups that were not covered. And Dr. Kirkpatrick mentioned in the Pfizer case, it is up to 16 and up, and then Moderna, it's 18 and up. We actually are already starting to get information about the vaccine studies that were done in 12 to 15-year-olds. And that actually came out about a week and a half ago that said that the vaccine is 100% effective in children. Now, we vaccinate against a lot of things, even children's vaccines, but there are very few things that are 100% effective in making sure that we continue to protect children. We will find out a little bit more about younger kids, that sort of like 6-month group, and we'll probably find out more about them sometime this fall, or I would say early winter. And so the goal is that by the beginning of next year, that we'll have really strong data to support vaccinating everyone. And so, the way that we think about it, people are like, well, why didn't we talk about children up front? And it's like, there's a lot of reasons why we didn't talk about children up front, but in the context of coronavirus, we really initially weren't talking about children because we kept them all at home. But we knew that adults were doing a lot of heavy lifting when it came to spreading the virus. That does not mean that children cannot spread the virus at all. And so in order to get everybody back, we are going to need to vaccinate children. But we also know that if we can support our children with intellectual and developmental disabilities to go back to school safely, an environment where kids and their parents care deeply about the quality of life. As long as we're able to get our most highest risk patients and people vaccinated, i.e. adults, we should be able to provide a safe environment for them to learn in the coming months.
I think we all feel passionately about that, and certainly getting teachers vaccinated is going to be critical too. Well, we are at the end of our hour, and I'm just curious, Dr. Kirkpatrick, is there, anything you think we might have missed, or any final, thoughts you want to leave with our audience about vaccination?
Yeah, I think the one message I want to hit home is to please get vaccinated, especially since it's going to be open pretty soon for everyone. Please make that a priority.
Thank you very much. Dr. Pandy, any important thing?
Yes, the same thing, like get vaccinated, it's safe. And there's no reason that why you should not be vaccinated. And then the sooner the better. As soon as you're eligible, get the vaccine.
Yeah, we're gonna hope that those lines just keep happening. Dr. Asante, thank you for your kind thoughts. Anything else final that you want to make sure and hit home?
Yeah, I also want to let people know, because I know that there's a lot of information out there about, well, this vaccine's better than that vaccine, and maybe I shouldn't get that one because of this reason. And I think Dr. Kirkpatrick said it best. Whichever one is available to you will keep you and your family safe. And so whichever one you're able to get, please get that one. As much as all of us as child health advocates want to see our world return to a space where we can send kids back to school and be able to live their lives, and at bare minimum do play dates again, remember those. We want to be able to protect you in those spaces, and this is one thing that we all can do to sort of take that level of fear from like a 10 to like maybe a 4 or 5, hopefully a little bit lower than that. But I think that the recommendations and the data that continues to come out about how effective the vaccine is at making sure that people aren't getting each other sick is really, really warms my heart. And it means that when people think about normal, whatever that looks like in the future, at least it means I'll be able to give more of my friends and family a hug. And who doesn't want that? So thank you guys so much for allowing us to chat with you guys this evening. It's a real pleasure.
I love it. We are so grateful to each of you. We know we cut into your family time this evening, and we appreciate each one of you so much. Again, this recording will be available on the Arc of Washington State website. We'll send out the link to everybody who registered tonight, and please stay safe, everyone, and have a great evening. Thank you.
Thank you. Bye.
Bye.